Mientras los quienes de Villaquién reían y comían, el Grinch desde su guarida su plan definía. Pensó, ¿cómo arruinar sus cenas festivas? Y le vino una idea, de las más retorcidas. Salpicaré sus papitas de verde, con sazón de pepinillo, y con esos feos calcetines verán mi retorcido motivo. Así que si quieres probar lo que el Grinch preparó, ve a McDonald's y verás lo que tramó. El nuevo Grinch Meal, ya, en McDonald's. En McDonald's participantes hasta agotar existencias.
Ba-da-ba-ba-ba.
Welcome to the Covert Narcissism podcast. I'm your host, Renee Swanson. I am not a therapist, and you are not a victim. If your body has been acting like it's in a horror movie, even though your life looks fairly normal to the outside world, at least, the world around you, then this episode is for you. Today, we're diving into something that so many survivors experience, but almost nobody talks about it. And clearly, a lot of people don't understand it. And this is the physical symptoms that you're experiencing when you're going through trauma. The jaw tension, the chest tightness, the digestive issues, the sleep problems, the buzzing in your ears that comes and goes, even that little eye twitch that feels like it's sending Morse code at completely inappropriate times. And here's something I really want you to hear. These symptoms that you think are random, they're not random. They're the map of what you've survived. They're the map of what you're going through. Your mind may not have recognized the relationship as abusive as quickly as maybe you would have liked, but your body absolutely did. Now, I know I'm talking to some of you who have Googled why is my eye twitching more times than you've Googled today's weather. You've convinced yourself that your liver, your kidneys, your heart, and possibly your soul is failing. All because of one rogue eyelid acting like it's auditioning for a TikTok dance. And I get it, because so many survivors end up doing this very same thing because we don't understand what our body is going through. You feel symptoms, you panic, you ask Dr. Google, who's actually becoming Dr. Chat now, you spiral, and then you finally go to the doctor to get answers. So you explain to the doctor, my chest feels tight, I can't take a full breath. My heart is racing for no reason. My ears are ringing. My stomach's a mess. My eye won't stop twitching. And the doctor listens kindly, and then they order some tests and they do their exam. Well, your heart, perfect. Your lungs are strong. Blood pressure's beautiful. Your blood work is impressive. Neurological exam, gold star. Your hearing, better than average. So they lean back and they say, everything looks good. I don't see anything alarming here. You're totally fine. No, I'm not. I'm definitely not totally fine, is what you want to scream. My body is behaving like it's in a thriller movie every night at 2 a.m. But you accept their answer, relieved that at least physically everything seems to be okay. You go back to your life to dig in again, to keep things stable or try to keep things stable one more time. Your body is not malfunctioning. Your body is adapting. Your body is protecting you. It has been telling the truth to you about your trauma long before your mind could actually name it or you could see it. A doctor, you see, can measure your heartbeat, but they can't measure how many times it's been broken. They can check your breathing, but they can't check how many nights you slept with one eye open because unpredictability lived in your home. They can examine your muscles, but they can't examine how hard they are working to hold things together. Trauma doesn't show up on an x-ray. Your labs come back normal because your body is incredibly resilient. It's been clenching, bracing, tightening, scanning, and surviving far longer than you realize. And all of that takes a toll. Welcome back to the Covert Narcissism podcast, where we explore the way trauma lives in the body, the subtle signals it sends, and the healing that becomes possible once you understand what your symptoms are trying to tell you. Now, there's something important here that we need to talk about, something that often gets overlooked when we start talking about the symptoms, the stress, and the trauma. Your body communicates with you through its discomfort. You see, your body has to have a way to communicate with you. Think about hunger for a minute. When you feel hunger pains, and yes, we call them hunger pains, your body is not malfunctioning. It's not betraying you. It's not creating unnecessary pain for fun. It's simply saying, hey, I need you to feed me. You see, your body can't get food by itself. It needs you. It needs you to pay attention. And if you had never learned what hunger felt like, if nobody had ever explained this sensation that your body has when it's asking for nourishment, if you didn't understand what this was, you might absolutely panic. I mean, imagine for a minute going to the doctor describing this stabbing abdominal pain, a discomfort that comes and goes and it rumbles. It makes all this noise and this rumbling sensation. And then I get really irritable and I might even get nauseous if I, wait too long. You might even say, something is wrong with me. Do I have cancer, an ulcer, a tumor? Now imagine that doctor who now thinks you've lost your mind. Imagine the look on their face when they say, the best thing I think you can do right now is go get some food. You see, this is how all the body signals work. They feel like a problem, but they're actually a communication. Your body communicates with you when it's hungry, when it's sleepy, when it's tired, physically tired, you've worked your muscles too much. Now compare this to what happens when we deal with trauma. Your body is sending signals to you. It's sending signals of danger, overwhelm, threat, emotional suffocation, hypervigilance, unmet needs, unsafe environments. But because nobody taught us that these sensations are actually messages, we feel them, we think something's wrong with us, and we panic. We feel chest tightness and we think, am I having a heart attack? We feel the jaw clenching and we think, what's wrong with my teeth? We feel our eye twitch and we wonder if it's a neurological disease. We hear this ringing in our ears and we assume that we have damaged our hearing somewhere. We feel digestive problems and we leap to worst case scenarios. But just like hunger is not a mistake, these sensations are not a mistake either. They are your body talking to you. Your body is saying, hey, the stress in your world needs attention. The tension that you're living under, it's too much. The threat you are under is real. And it's also saying, I can't resolve this without you. Your body does not want you to be comfortable in unsafe circumstances. Comfort means you won't act. It means you won't do anything because you don't feel discomfort. Discomfort is your body's strategy for survival because discomfort causes you or pushes you to do something. Pain and symptoms are not punishments. They're communication. They are your body saying, please don't ignore what's hurting you. Please don't normalize what's breaking you down. Please don't stay in environments that require you to be in fight or flight mode every day. Your body can't use words, so it uses sensations. Sometimes loud ones, sometimes scary ones, sometimes persistent ones. Not because something is wrong with you, but because something is wrong around you. And your body needs you to be aware of this. Now let's start talking about some of these symptoms. Let's start with tinnitus, that sound of hypervigilance. It's that buzzing or ringing in your ears that shows up during stress. It spikes at night and it can come on strong after an argument. I had a woman tell me recently, I thought I had damaged my ears, but my hearing test was perfect. The ringing started in the last few years of my marriage, and now it gets loud when I'm overwhelmed. Well, this is classic trauma-related tinnitus. When your nervous system is stuck in fight or flight mode, the auditory system becomes hypersensitive. Your brain increases auditory gain, heightening your sensitivity to both external and internal sound signals. Your tight shoulders, even your jaw tension, can irritate the nerves around your ears, and adrenaline shifts the blood flow in your inner ear. The result of this is a sound that feels like it's coming from the room, but it's coming from inside you. You might start looking around to see where the buzzing's coming from, but it's your survival system inside of you. So what do? How do you help this? Because going to the doctor, they tell you your hearing's fine. They check your ears and they say, no, your ears are good. Here are some things that you can do that will help you with this tinnitus. Number one is to downregulate your nervous system. Slow breathing, gentle movement, and grounding help shift you out of this fight or flight mode. When the nervous system calms, auditory sensitivity decreases and tinnitus often softs. Number 2 is jaw and neck relaxation. Releasing the tension in your jaws, your temples, and your neck reduces pressure on the nerves that connect to your ears. Even a few seconds of jaw release can noticeably lower tinnitus intensity. Number 3 is grounding your body. Grounding pulls you out of that hypervigilant mode. Feeling your feet on the floor, adding some weight or pressure, even holding a grounding object such as a stress ball or a smooth rock sends a safety signal to your brain, reducing the need for this heightened sound scanning. Number 4, calming your breath. Long, slow exhales activate the parasympathetic system, lower your adrenaline, and stabilizes that inner ear function. This helps to prevent the brain from amplifying the internal noise, which is what tinnitus is. Number 5 is to notice when the tinnitus gets louder. Tinnitus spikes are signals, not defects. They show your nervous system that it's overwhelmed, that it's anticipating danger. So when you treat them as cues, not as problems, you can respond with grounding and breathing instead of fear. For many survivors,
Mientras los quienes de Villaquién reían y comían, el Grinch desde su guarida su plan definía. Pensó, ¿cómo arruinar sus cenas festivas? Y le vino una idea, de las más retorcidas. Salpicaré sus papitas de verde, con sazón de pepinillo, y con esos feos calcetines verán mi retorcido motivo. Así que si quieres probar lo que el Grinch preparó, ve a McDonald's y verás lo que tramó. El nuevo Grinch Meal, ya, en McDonald's. En McDonald's participantes hasta agotar existencias.
Para pa pa pa.
the ringing fades as emotional safety grows. It's not in your imagination. It's your body's alarm system learning that you're safe again. Now I want to talk about jaw clenching and TMJ. If I lined up every survivor that I worked with and asked, raise your hand if you clench your jaw, almost all of them would raise both hands and their shoulders too, because we're really good at that too. Jaw clenching is one of the most universal trauma responses, especially in covert abuse. Because when you can't speak your truth, when you're walking on eggshells, when every conversation feels dangerous, your jaw becomes your gatekeeper. A client once told me I didn't know I was clenching until my dentist asked if I was stressed. I thought it was a strange question, and I thought, well, not that stressed. Turns out that I was clenching my jaw 20 hours a day and didn't know it. Your jaw is one of the most powerful muscles in your body. And when it tenses, it isn't random, it's protective. Why does this happen? Because you have unspoken thoughts that are held back. When you hold back what you really want to say, that jaw that becomes your gatekeeper, that tension that forms in your body is physically containing the words that you feel unsafe to express. When you swallow your own emotions, feelings that can't be released, they don't disappear, they move into your body. That jaw absorbs your sadness, your anger, your frustration that you're not permitted to show. Fear of conflict. If conflict has historically led to blame, withdrawal, or punishment, your jaw braces automatically. It prepares for that impact long before anything ever actually happens. And needing to stay quiet in order to stay safe, in these covert narcissistic environments, silence becomes survival. Your jaw tightens to keep you controlled, composed, and small, off their radar, because speaking your truth never felt safe. So here are some things you can do to help with the jaw tension that you might be dealing with. Number 1 is progressive jaw release. Gently tighten your own jaw and then slowly release it. The contrast teaches your nervous system what relaxation feels like and helps to retrain those muscles that have been clenching for years. Number 2 is dropping the tongue from the roof of your mouth. Letting your tongue fall away from the palate instantly deactivates the jaw muscle. It's one of the quickest ways to interrupt bracing and signal safety to yourself. Number 3, we go back to this exhale thing. There's some magic in this. Lengthen your exhale. A slow, long exhale activates the parasympathetic system. You're going to hear me say that many times. But this also reduces jaw tension from the inside out. It turns off the prepare for danger mode that drives all that clenching. Number 4 is massage around the temples and the jaw hinge. Light pressure around the temples and around the jaw loosens that muscle, increasing blood flow and helps the jaw to return to its neutral resting state. Number 5, As always, notice when you clench. Most people clench before conflict, not during it. Catching yourself in that anticipatory tension lets you pause and remind your body, I'm bracing for something that isn't happening right now. Right now, I can relax. When the jaw softens, many survivors say it feels like their whole being exhales. Now I want to talk about the eye twitching, this tiny muscle in you that carries a huge load. We talked about the jaw muscle being such a strong and powerful muscle. Your eye muscles are these itty bitty little muscles. And this is a symptom that nobody really connects to trauma, often does not connect to trauma. But nearly every survivor has experienced it at some point. Eye twitches. Those annoying little spasms in your eyelid that show up out of seemingly nowhere. They often come during high stress seasons, but again, we don't pinpoint that. They come during conflict cycles or when you're emotionally exhausted. I had a client tell me once, this is going to sound ridiculous, but my left eye has been twitching for 3 weeks and I can't make it stop. She had spent years monitoring her partner's facial expressions, scanning the microshifts, the tightening of the mouth, the raised eyebrow, the sigh that meant she was about to be blamed yet again, and her nervous system was constantly reading the room through her eyes. So that tiny twitch, it wasn't random, it was exhaustion. It was again the hypervigilant state, expressing itself in now the smallest muscle in the body. Why does our eye twitch during trauma? The eye muscles stay in alert mode during constant scanning. When we're in a hypervigilant state, we scan all the time. Chronic stress drains your magnesium, which triggers muscle spasms. Okay, so if you're dealing with muscle spasms, this is a piece of it. Suppressed emotion often shows up right around the eyes. Sleep deprivation, which many of us are dealing with, makes twitches much more likely. And then there's this thing called micro-bracing. Micro-bracing refers to the tiny, almost invisible ways that your body prepares for threat. They're not big reactions. You're not flinching or tensing your whole body, but small, continuous tightening in your muscles around your eyes, your forehead, your brow. This is called micro-bracing. These tiny little muscles stay slightly contracted for way too long, sometimes all day, even all night, because your nervous system is constantly scanning. These micro tightenings happen hundreds or even thousands of times a day when you're living in hypervigilance. Over time, these tiny muscles do exactly what any overworked muscle does. They fatigue. And when your muscles fatigue, they twitch. So that fatigue from the microbracing simply means your eye muscles have been doing small, constant threat preparation work for way too long, and they eventually start to misfire. It's the same way your hand might twitch after gripping something tightly for too long. These little spasms are a sign that your system has been running too hot for too long. So what helps? Number one, closing your eyes for 10 to 20 seconds to interrupt the scanning. Even a short pause in visual input gives your eye muscles a chance to reset. This break interrupts the constant threat scanning loop that the brain is running, signaling that it's safe to momentarily power down. Number two is a warm compress over the eyes. Heat relaxes those tiny muscles around your eyes and your forehead. It eases the tension in your eyelids, and it shifts the nervous system towards that parasympathetic calm, which is what we're after. It's one of the quickest ways to stop a persistent twitch. Number three is softening the brow and the eyelids intentionally. Most survivors don't realize how tightly they hold their brow. Consciously releasing the forehead and letting the eyelids gently relax tells the brain we're not in alert mode right now. Number four, reducing screen time before bed. Screens keep the eyes in hyper-focus mode and stimulate the same muscles that are stimulated during hypervigilance. So cutting screen time allows the eye muscles to unwind and prevents the twitching that often ramps up at nighttime. Number five is magnesium support. Chronic stress depletes your magnesium. Please pay attention to this because magnesium plays a huge role in muscle relaxation and nerve stability. Supporting magnesium levels with supplements and other things, and talk to your doctor to get their guidance when you need it, can reduce twitching and overall muscle tension. And number six, Grounding techniques, again, to downshift your entire nervous system. When the whole system calms, the eyes stop scanning so intensely. Grounding, like feeling your feet on the floor, holding a weighted object, or slow breathing, helps shift the body out of hypervigilance and reduce the twitching. If your eye won't stop twitching, that doesn't mean you're stressed out in some vague way. It means your body has been trying to protect you through hyper-awareness, and those tiny muscles are carrying all of that weight. This system is incredibly common among survivors. You're not alone. You're not weird. Your body is simply asking for relief. Now, we're going to pause right there, and I'm going to continue this episode next time with a few more of the symptoms and issues that your body is dealing with, the communication that it's trying to have with you. Join me next time as we continue this journey towards the specific symptoms that you are dealing with, what they mean, what they're communicating to you, and how you can get them to relax. I wish you so much peace on your journey of healing. You have been listening to the Covert Narcissism podcast, where we break apart the insidious nature of these incredibly destructive and infinitely frustrating individuals. If you are caught up in this crazy-making relationship and drowning in self-doubt, guilt, or rumination, please reach out to me anytime. I offer individualized live coaching in both group and individual settings. We can find the right program for you. You do not need to go through this alone. You can find all of that information on my website at covertnarcissism.com. You can also reach out to me by email at Renee, RENEE, at covertnarcissism.com. I do look forward to hearing from each and every one of you. Remember, I am not a therapist, and you are not a victim. I am a coach, and you are a survivor. The information provided by Renee Swanson, Covert Narcissism Podcast, and CNG Life Coaching is for educational purposes only and is not to be used for diagnosis purposes. It is not intended to be a substitute for clinical care. Please consult a healthcare provider for guidance specific to your case. This material discusses narcissism in general. Renee shares stories from her personal experience as well as from those that she has worked with for several years. Her material does not claim that any specific person has narcissism and should not be used to refer to any specific person as having narcissism. Permission is not granted to link to or repost this material to support an allegation or support a claim that any specific person is a narcissist. That would be an unauthorized misuse of the material and the information provided. Thank you.
Mientras los quienes de Villaquién reían y comían, el Grinch desde su guarida su plan definía. Pensó, ¿cómo arruinar sus cenas festivas? Y le vino una idea, de las más retorcidas. Salpicaré sus papitas de verde, con sazón de pepinillo, y con esos feos calcetines verán mi retorcido motivo. Así que si quieres probar lo que el Grinch preparó, ve a McDonald's y verás lo que tramó. El nuevo Grinch Meal, ya, en McDonald's. En McDonald's participantes hasta agotar existencias.
Para pa pa pa.
If you like the show, please take a moment to rate, review, and subscribe. It really does help the show to grow. Thank you for listening.